I'm Dr. Brandon Shulman. I am an orthopedic surgeon with a special interest in hand and upper extremity surgery, as well as traumatic injuries throughout the body. Trigger finger is a common problem that we see in hand surgery, where the tendons that flex our fingers run through a tight canal at the base of our fingers. When tendons become inflamed or see inflammation, they can form a ball-like structure that, as it attempts to pass through a tight, thick band of tissue overlying this region, it doesn't properly pass and becomes stuck. The symptoms of trigger finger are pain in the hand and also locking or catching, or in severe instances, a permanent lock of our finger at our, what we call our proximal interphalangeal joint, or our first joint past the knuckle of our hand. And the reason it's called trigger finger is because of thinking about how a trigger on a gun would be pulled. You would use that joint to collapse the trigger on the gun, and that is what patients often feel. They often feel locking or catching that gets stuck and they have to pry their finger open. Trigger finger can resolve on its own, and patients with mild pain that occurs in the hand, or even occasional catching, sometimes this inflammation will just go away on its own. Sometimes with the help of anti-inflammatories such as ibuprofen or Aleve, this problem can resolve. The good news with trigger finger is, even if our conservative measures such as injections and anti-inflammatories are not successful, the surgical cure for this is very benign. By incising this ligament, there are many other pulleys and areas of tissue that overlie this tendon throughout its arc, so there's no loss of function by cutting the A1 pulley or this tight band of tissue, and patients simply get relief of their trigger finger without any lasting deficit or functional problem in their hand. Trigger finger is one of the most common problems we see in hand surgery. It is a problem that many people throughout the world see with no past medical history, but we know what causes the trigger finger, and it's essentially that tendon passing through that space that's too tight.